needle on 69 patients. 51 of the patients have had some experience receiving anesthesia from a ready-made needle, while 18 of them have not. Prior to injection, we showed our patients the modified needle and explained it as a special anesthesia or magical stick. We then trained the patient using an injector without a needle. After training, infiltration anesthesia was injected into the gingival cord without surface anesthesia. Here, a dental hygienist is training a patient for the injection. She is using an injection without a needle. The rating system we used for our new injection needle on patients was as follows. 1. Effective. 2. Practically effective. 3. Not effective. Here, this is me doing true anesthesia with a needle after the patient has completed the training. Here, the two patients were the benchmark for effective. This graph shows the effect on the patients relative to their experience with anesthesia. This graph shows the patient's reactions to ready-made needles. We can see our data showed a positive effect on about 70% of the patients who had previously refused injection with a ready-made needle. In regard to patients with intellectual disabilities and autism, our data showed that it was about 80% effective. This is including practically effective patients. In regard to age group, it was least effective for autistic children under the age of 6. The needle is relatively safe even if the patient reacts suddenly. Originally, we designed the slide cap injection needle for an adult disabled patient of ours. She was a very difficult patient. We had to train her on every dental tool you can imagine: the drill, explorer, air scaler, and many more. She eventually would let us use these tools. However, the needle terrified her, and she refused to have it near her. The problem I had was the needle itself. She was not afraid of pain. It was the needle. I was very nervous the first time I used this slide cap needle on her. However, she responded very well, and I was able to complete the injection. In fact, it went so well that I decided to use the needle on all of our fearful disabled patients. We had so much success that we tried to adapt the needle to children. Moreover, it is also effective to use in combination with an electric injector. It stands to reason that patients experience sense of relief when the needle is not shown. In fact, in actual clinical application, the slide cap needle exceeded our expectations. However, we have experienced some difficulty when using the apparatus on almost all of our autistic children under the age of 6. For normal children, we've had mixed results, and these cases can be evaluated on a case-by-case basis. However, despite this, I wholeheartedly believe that if you try our needle, you will be amazed at how effective it is. That is, most patients showed little resistance to being injected with our new needle, not only for the first time, but also the second time, and so on. During training, we used the words magical or special to describe the apparatus. These non-threatening words may have helped create a sense of relief in a patient, similar to a placebo effect. The role of a dental hygienist is very important, especially when training the patient by using an injector without a needle. The medical profession tends to look towards the newest and the most advanced medical technologies, instruments, and devices for the development of dentistry. However, both patients and practitioners share the viewpoint that there is room for improvement and ingenuity in the field. Analysis confirmed that to some extent, our newly developed injection needle with slide cap provided relief and safety to both the medical professionals and the patients who were previously afraid or very cautious. Our process was effective in preventing a needle stick incident, since it could be immediately leak out in the oral cavity after the completion of anesthesia.
Thank you for your interest in my needle. The modifications we made to the standard needle were very simple. However, this small change has made a very big difference in the lives of our patients. Sometimes, the simplest thing is the best answer and should not be overlooked. If you have any questions about my needle, now or later, please come to talk to me. I have two labs. One is being a dentist for disabled patients, and secondly, jazz. If you don't have any questions about my needle, but want to talk about jazz,